Hey guys, week 5 we're talking about antibiotic resistance, and with that comes what is antibiotic stewardship, our role as a provider, and our role as a consumer. So antibiotic stewardship essentially is, what are we doing to be good stewards about the use of antibiotics and promoting health through not abusing antibiotics. So the CDC recommends several things. Is that it's kind of like, or you think about the 6 rights of drug administration. So we got 4 things that they listed for good antibiotic stewardship. That is the right drug, the right dose of the drug, the right time, and the right duration. So for hospitalized patients, we want to make sure that they receive all of those things in the right combination and that we're not abusing drugs. So we're making sure that we get the cultures for our patients, that we're not just slapping everybody on broad spectrum antibiotics, and that as nurses we are keeping up with these drugs that they're getting, and they're not extending that, every 48 to 72 hours, that we're thinking about where they're at in their antibiotic therapy to make sure that we're not just slinging Vanc at everybody and leaving them on Vanc for a week and not really pushing the providers to make decisions about weaning them off or discontinuing their medications. We also want to make sure that is the dose appropriate for that patient? Is it a weight-based dose? Is it not only that is different antibiotics have different dosing regimens for the type of bug you're trying to kill. So let's make sure that we're not just throwing not only a hard-hitting antibiotic but a heavy dose at them. We've already talked about the time, making sure that they're not on that. Well, the time is that we start the antibiotics when they need to be given, and then for scheduled doses like things like Zosyn, that they're getting them at the right time intervals, and that they're receiving it for the correct duration while they're on it, and then also the duration, making sure they're not on it for just a week at a time. So as our provider, our role as a provider, what can we do to make sure that we're not overusing antibiotics? Well, we can make sure that we're not passing things along to our different patients. So the best thing we can do, God, you just hear about it, our hospital has hand washing auditors, and it's so silly, but good hand washing is absolutely imperative, that we're not moving bug from room to room. And we need to make sure that we follow appropriate isolation measures. And then screen patients that are transferred. I know all transferred patients from outside facilities, like from skilled nursing facilities or other hospitals, they automatically get MRSA screen when they come in, a VRE screen. So we want to make sure that we're doing that for our patients. And also, if they're on contact, we want to make sure that we are following contact. We need to know that the hand sanitizer, the Purell, that's not going to work for C. diff. So good hand washing. We got little placards over, our Purell dispensers everywhere in the hospital that says, hand washing is only going to be good for C. diff, and the hand sanitizer is not. So let's be good on hand washing and making sure that we're doing the correct isolation procedures. I know that yellow gown is gets hot as pretty hot, but we need to be doing those things. And it kind of wraps back around to good stewardship is, as a provider, we need to be staying on the physicians and making sure that they're doing the things that they need to do, follow up with the patients, and making sure that they're not on these drugs for an extended amount of time. So being a good provider wraps around to back to what antibiotic stewardship is. Then our role as a consumer. As soon as I read this, first thing I thought about was my kid. So, I see these things floating around on Facebook all the time. It's like, I'm sorry, your parents are nurses, because we're never going to take you to the emergency room. And my wife and I kind of joke about that. She's a nurse as well. That he's got to be in bad shape before we'll take him. But really, what it boils down to is that we know that there's not a pill that's going to fix a virus. And most always little kids end up with viruses. These runny noses they have, these colds, these coughs, they're just viruses. And unfortunately, you have to kind of Tylenol and ibuprofen them out of, you know, being whiny, or you know, if their throat hurts, so they're having pain, or you know, their head hurts from being, you know, having some stuffy sinuses. So we try to be good antibiotic stewards, but maybe not good pain medicine stewards. But you know, the CDC wanted you to remember that things that you can't fix with antibiotics are your colds or flus, most coughs and bronchitis, sore throats that are not caused by strep, and runny noses. So as a consumer, we need to make sure that we're not just taking, you know, ourselves or our children straight to the doctor every time they get a cold or a cough, or they might feel bad, or they run into low-grade fever. So, you know, with the exception of that, he's had 1 or 2 ear infections, you know, that's kind of followed a cold. So what we have done to try to prevent that, and you know, is keep his runny nose from turning into any worse that you can. And sometimes when he was very little, that meant, you know, bulb suctioning out his nose, and you know, that was uncomfortable. But it avoided him having to get antibiotics for ear infection that came after that, upper respiratory infection, or maybe other medicines that, you know, where his URI turned in, you know, into worse, into like bronchiolitis or something. So that's what we can do as a consumer, is make sure that we're not just rushing right to the doctor and pushing that we need antibiotics for this or that. You know, we really need to try and push through things as we can. And you know, if it's cold season, flu season, make sure you're getting your flu shot. Make sure, you know, you're taking vitamin C and things like that, where you don't end up getting sicker, where you need some antibiotics for another issue. So those are the things that we can do to help overcome antibiotic resistance, which is going to be a big player, and the CDC feels like is going to be a big issue in years to come. Thanks, guys.